All right, everyone, welcome back to those of you who watched through part one of Ask Larry and Bob, the summer edition 2021. Here we are, part two. So as you know, I am Stephanie Mandeville, Communications Director for NERI, joined by Bob Walsh and Larry Pirtle. Hi, guys.
Hi again, Steph.
I'll pretend we haven't been talking for an hour and a half. So we're splitting this up because we have so much to discuss. So the first part of our summer edition was touching base on all of the things that have transpired since May earlier in the year. Obviously, COVID and this crisis, the Delta variant, we are approaching back to school. We are starting to hear from members a little bit, whether it's through social media, through email or whatever. Sensing a little anxiety about what are we walking into, what are we doing to mitigate. There are a couple of things for us to talk about. Obviously, the Delta variant is what has changed the guidance, not politics. Messaging maybe could be a little bit better, but we can talk about that. And we know that the American Academy of Pediatrics in recent weeks, as well as the CDC, issued guidance recommending universal masking in K-12 school environments come the fall. Larry, talk a little bit about what our message has been since March of 2020, really.
Well, as we've said for the past 16 months, health and safety of our members and students is the number one priority, and we're going to follow the science and the medicine. And you're right, the Delta variant has changed things. Certainly this what the CDC has come out with, that whether you're vaccinated or not, you can carry it and you can spread it. Although we want to continue to say that if you're vaccinated, you're much better off. And that's something that we can talk about. I don't understand why outside of people who have health conditions aren't getting vaccinated, and that's something we continue to push for. People need to get vaccinated because that's how we're going to get out of this. The thing that we were hoping we wouldn't have to deal with going into school was wearing a mask by people who are already vaccinated. But we're gonna, we still have almost 5 weeks to go, but we're gonna have to see. The recommendations can change, but to keep our members safe and our students safe, we're gonna have to follow the science and what the CDC and what the Department of Health say. And right now it looks like it's gonna be mandatory mask wearing. I'm certainly in favor of mandatory vaccinations, but I'm not sure that's going to come. But we just saw, I read today, the United Auto Workers have just agreed that in all their factories, they'll be, whether you're vaccinated or not, you're going to be wearing masks. So I think, and we know some hospitals are doing it around the country, or the courts have upheld that they can do that. So I think, unfortunately, that's the direction we're moving. Because some people, Rhode Island has a high number of people being vaccinated, but still the unvaccinated are impacting everybody else. And we still have students under the age of 12 who aren't vaccinated, and parents are concerned. So it's what we thought might be a little easier start of the school year a month or so ago is now turning into
Deja vu.
Yeah.
Deja vu, but I personally feel a little bit better going into this, just knowledge-wise. I mean, we've been through this hell once. So I am being much more, again, personally, I'm being much more mindful of who I'm listening to, because you can get, fall down this rabbit hole if you're on Twitter or, social media or even news reports, and your head will swirl by the end of the day, trying to just keep it all straight. Larry, you talked about the unvaccinated and obviously in my house, I have an unvaccinated under 12er. I'm sure a lot of people watching this do as well. So it's just trying to balance your risk and figure out how to proceed. It's a little harrowing. I've been following Dr. Ashish Jha on Twitter. I find comfort in his words because he has not really changed all that much. It's just sort of been straight all the way. Bob, what do you want to say about our message and about what our folks are what they're walking into and how they're walking into it come August 31st or September.
Congratulations and thank you to the vast majority of our members who have already been vaccinated. I think overall we hit it out of the park. The data suggests as many as 90% of our members are already vaccinated, and that's an accomplishment that 90% of you should be proud of. I think I like what you said, Stephanie, that, you know, feel a little bit better about the information, but the downside of that is I think the intelligence is better, but the wisdom is still lagging. And I struggle with the right analogy. You know, the other day I tweeted out that as Rhode Islanders, we still line up to buy bread and milk because of a blizzard in 1978, because we want to be prepared, but some of us still refuse to get vaccinated or think masks are some sort of hoax. And as far as the masks go, I distinctly remember 2 periods of time where I couldn't order Caesar salad because the CDC said, don't risk eating romaine lettuce. So if you were skipping Caesar salad and the restaurants were smart enough not to serve Caesar salad, the same group is saying, put on your damn mask so we can protect Stephanie's daughter and somebody's grandmother and everybody else. And I realize that's the frustration of the group project, that we're doing the work to protect those who are not fully participating, but it is significantly better than the alternative. If I read one more plaintive plea from the family of someone who is literally dying on a ventilator in the hospital because they were too stubborn to get vaccinated, I think my heart will break. I realize we are mostly preaching to the choir. Like Larry, I actually would support and hope they mandate vaccines so we can get that going. And I realize that's not a popular opinion with this very small subset of our members. In 2 weeks, more or less, Dr. Fauci tells us the FDA will give final approval to at least the Pfizer vaccine, with Moderna close to follow. So the final that, oh, well, this isn't approved, will go away. And after that, I will not be surprised if you see a lot more mandatory vaccination rules coming, at least in the private sector, possibly in the public sector. Brown University has already mandated that vaccine for all staff and all students on campus. And that's where Dr. Jha works. So take a hint on this one. As far as the everything else, yeah, we're as nervous as you are, because they're going to now we know what to do because we did it last year, but I would not be surprised. First of all, masks for the transportation part of the school system are already required. So the kids are going to be wearing masks on the buses. I fully expect they're going to be wearing masks, and all are in the schools for the foreseeable future after the start of school. Delta variant they just changed the game. That R-value thing that we educated everyone on math last year, used to be in that 1 to 2 range that's the rate of transmission for the virus. For the Delta variant, it is in that 8 to 9 range. It's like chickenpox. And if you're my age, you remember that the parental attitude of we might as well get it over with. If your friend down the street had chickenpox, mom brought all the kids down, might as well expose them now and just get it done, because everybody was going to get it. And that is how quickly and how easily this Delta variant spreads among the unvaccinated. And don't take your information from Twitter. Don't even take your information from me. Look it up. And if there's a doctor, you know, this is the old Dentyne ad. If 4 out of 5 doctors who you respect are saying something in agreement, that's probably the right way to go. Dr. Jha, Dr. Fauci, Dr. Rainey, Dr. McDonald, Dr. Alexander Scott, there are 5 right here in Rhode Island. Listen to what they have to say. Follow the advice. We will get through this. I think Stephanie got the quote from someone that I've been using a lot, saying, we are not post-pandemic, we're just post-vaccine availability, and that's different. And we will get through this. Of the alternatives, schools being open is so much better than distance learning in this format that we're using right now. But the only way that's going to work if more people get vaccinated and more people mask up. And this is where I will give political credit. When Dan McKee came in as governor, He made it a priority to get our folks vaccinated. And no one can say they did not have availability of a vaccine. And they have been pushing that agenda through the state. And we've seen an increase in the rate of vaccinations in the public since they renewed that effort in the last couple of weeks. And I think once we get final approval, that will continue into the fall. So that's the.
I think it's important too to balance national information and statewide information too. We're in a very different place, even just back to school. There are some districts that I don't know if they ever went back across the country. We're just in a different place here. And so again, I'll speak for myself personally. I often, when seeing national news stories, will then have to just temper it with the fact, okay, we know where we are here. I trust the people so far and what's happening. How do you feel about Governor McKee's approach? He did his, Larry, I'll ask you first. How do you feel about his approach? His press conference was yesterday, and he basically said, we're staying the course here. We feel like we're okay, so we're staying the course.
Yeah, and I think one of the frustrations is that, and I know I'd like to have it, we'd all like to have it, our members would like to have, what exactly is, that second week in September going to look like when students return? The problem is this changes so much on a daily basis, but I think the idea of keep pushing vaccinations, encouraging everyone to mask up, and then if you get to the point where you have to mandate that, then do it. I know some districts, East Providence is a good example. They are sending out information about the opening of school now. Get vaccinated. Here's what we expect. We're encouraging you to wear masks. They're also doing a 2-day, I think they're calling it a vaccination boot camp with the fire departments in town to get more people vaccinated. And we've talked about getting involved in some of those things. The more people that can get vaccinated, and as Bob said, if they give formal approval in the next 2 weeks, especially to Pfizer, that should help. And we are seeing around the country the uptick in people getting vaccinated. So the more people that get vaccinated, the safer and the easier the opening of school is going to be.
So I want people to know, our folks especially, we're not taking resting back on any of this. I don't want people to hear in our approach today that we're just, whatever they come up with, that's what we'll follow. We are actively in this. It's important for our folks to know that. Bob, can you just
thanks for saying that, Stephanie, because that's and there's confusion about that, especially if you look at national media. Well, the unions we still get to bargain the impact of changes that affect our working conditions. If there was a mandatory vaccine order, we still get to bargain the impact. When does it happen? If you are, have a side effect, how do you discharge time, or do you get a sick day for free, basically, if you have a side effect from getting the vaccine? For the testing side of it, for those, and, protecting folks with religious or health exemptions who cannot get the vaccine, making sure that there are allowances made for that. So all those things are, bargainable because they are the impact of something that's being imposed. And presumably in the same way with the masking. All the other stuff we're paying attention to in the same way. We referenced in part one of this show that a year ago, we were actually taking one local school district to court because we did not think they were complying with the health and safety regulations. While we did not prevail on the underlying issue because of a glitch in the law, we prevailed on the overall issue because it got them to pay significant attention to changing those filters that had never been changed in years. So we get to pay attention to all those things as well. And if, God forbid, we have to go back to a distance learning model, which we don't anticipate, but we don't know. We honestly don't know what's going to happen. We'll be prepared to bargain about that as well. And that is not, as our opponents say, obstructionists. Those are not only our role, those are our rights in protecting our members. This is why we have unions. This is why a unionized workplace, the workers have more say because they have those protections in place. And, the sad thing is we're going to have more data because we open school relatively late compared to other parts of the country. The folks that open as early as the middle of August will have 2 weeks of data from other states on how things are playing out, and we will adjust accordingly. I think for the first part of the question, Governor McKee and our other elected officials are trying to balance not creating needless panic while underscoring the seriousness and the ever-changing nature of this debate. The most depressing thing I'm going to tell you is there will be other variants. Viruses mutate. The Delta variant got headlines because it's more successfully transmitting to people. There will be some other Greek alphabet letter variant that gets similar headlines until we get ahead of this thing. And the best way to stop it is to get everybody vaccinated and to wear masks as needed in the meantime, because this is your mini science lesson. Where do viruses mutate? They mutate in the host. So if you are unvaccinated and you get the virus, you get the Delta variant and it mutates, and the Gamma variant or some future unnamed one comes out, you were the host that caused that to happen. You were the typhoid Mary. And one way to reduce that probability greatly is to be vaccinated and wear your mask. So don't be part of the problem, be part of the solution. If you have my fair skin, you put sunblock on everywhere. You might still get a little burn on the spot you missed. But overall, the vaccine is like sunblock. You're a lot better off having it than not having it. And I still struggle with these analogies. If you have a better one, send it along to us, because we'll use it as we talk about this and try and explain it to the reluctant folks.
Yeah, so we took a break for a little while, but now we'll probably be doing this a little bit more. There are obviously things that are of import going back to school. Can you guys talk a little, we talked a lot, obviously, as we very often do, about K-12, but can we talk a little bit about higher ed and what their scenarios are for going back? I think all the students are mandated to be vaccinated, correct?
We were the first state in the country where all the higher education institutions cooperated together to make vaccination mandatory for all students, again, with the exceptions for underlying health conditions and religious. That's a huge breakthrough. Some places, I mentioned Brown, are also requiring it of faculty and staff. And again, for those, and for all the exceptions, whether it's students or faculty and staff, if you don't do that, masking, although it looks like everyone's going to be masked now, and weekly testing for those that aren't vaccinated. At Roger Williams University, they had a robust testing program last year. I assume that will continue for the unvaccinated. And we have the folks at RISD as well. RISD does not currently have a mandatory vaccination rule for faculty and staff, but similar protocols. And at URI and CCRI, where we have folks, there is not yet a mandatory vaccination rule, but another question we'll address in future episodes, because we don't have the answer yet, is the booster shot question. Literally, as we're taping, something popped across my screen saying the World Health Organization, another group in the alphabet soup of the organizations weighing in on this, was suggesting holding off on boosters, but I don't have the details of it because, as I said, it just popped up on the screen.
I think they were saying hold off on the boosters because there are still pockets in our world of people who don't have access to the first dose that they need. So
yeah, that's again, a
it's
supply logistics issue too. It doesn't necessarily help us to have one less glass of water because there's a drought in California, because unless you can move the water from one place to the other,
right.
And vaccine production is ramping up. But the other question on boosters, right now, the boosters that they talk about would be a third dose of the same vaccine, as opposed to when you get your flu shot every year, as I hope you all do. It's a different
Right.
structure for the flu shot every year that is anticipating the 3 or 4 strains of flu that are likely to be prevalent. That's why, by the way, in flu shots, you can have efficacy rates as low as 55 or 60% and as high as 80 to 90% because on how good they are on correctly predicting what variations are going to go in circulation. So far, at some level, all the various COVID vaccines work against the other variations, but again, at different percentages of reliability, but still pretty good, all things considered.
So we'll obviously, as we have said repeatedly, we're anticipating information to change or more information to come in. So as that happens, we'll come back to the space or maybe in person. I don't know. I think technology gets in our way with that. I don't know how we'll work on that. I'll work on that.
Well, I'm glad you said that because our goal was some level of reopening the office in September. We might have to hold off another month for meetings. There are staff in and out of the office as needed now, but we have not hosted any meetings of any meaningful level. Maybe one person will come in who we know is vaccinated to meet with other people who we know are vaccinated, but not, we certainly haven't hosted any negotiation sessions or anything else, and we're being careful like everyone else is.
So I'll take this opportunity to remind our members to, if they have questions or if they have any issues, to keep the line of communication with their local president open. And our local presidents are great and have good relationships with their UNISERV directors. So all of that is circulating around. So I'll also put back into circulation the question submission form. If you want to talk directly to us and ask specific questions, you can certainly do that. But absolutely make sure you have an open line of communication with your local president. Any closing remarks, Larry?
This is going to evolve over the next month. And I think, people just, unfortunately, we don't have all the answers, but I think the comment you made earlier, we certainly have more information or we have better ways of accessing that than we did a year ago. We're going to continue to work with everyone. We're talking with the superintendents and school committees and in the RIDE, all trying to make sure that we have the same message going forward so that it'd be nice if, yes, Westerly is different from Providence and East Greenwich is different from Burrville, but if everyone can have the same message going forward and somewhat the same procedure going forward, it'll make it a lot easier. And things could change, but the one thing, get vaccinated. If you're not vaccinated, get it. If you're reluctant to do it, not for political reasons, because I'm going to just say it, I have no tolerance for that at this point. I mean, but if there's a reason, you're not sure about it, this or that, talk to your doctor, find out, talk to people who know, because right now and going forward, the safest thing you can do to protect your family, yourself, and your students is to be vaccinated.
Rhode Island is very good at rallying behind one child who's sick, who's in need. We do all sorts of things. We hold bake sales, we get lots of publicity, we rally, we pray. We've got 140,000 children coming back into the public schools in the fall. Not asking you to rally. You might want to pray. All we're asking you to do is be vaccinated and wear a mask. It's not a lot to ask, Let's have fewer Make-A-Wish kids by granting the wish in advance and doing those two very simple things for 140,000 public school students in Rhode Island.
Agreed. All right, gentlemen. Everybody else, make sure you enjoy as best you can the remaining weeks that we have in this summer. Hopefully they are sun-filled. So thanks, guys.
Good. Thanks,
Thank
Jeff.
you.
Thanks, Bob.